All right, we're going to move on to identifying muscles now. And the first muscles we're going to start with we're going to refer to as axial muscles because they're found along the axis of the body. So just like we have the axial and appendicular skeleton, we have axial and appendicular muscles. So for axial muscles, we're not going to cover that many. So we're going to spend the bulk of our time on appendicular. So this is going to be a relatively short lecture. So the way I have this set up, I'll give you a muscle. And then for each muscle, it's going to have an origin and insertion. And remember, the origin is where one end attaches, the insertion is the other end. The origin is always less movable. And then the A is the action for the movement that the muscle causes. Now, we're going to assume that all muscles are shortening when they're contracting right now when we talk about these movements. And one hint that you can look at, if you can identify the direction that these fibers are running, like in this muscle, you see they're running kind of at an angle like this. In this muscle, they're running like this. That gives you an idea of which way they're going to contract. So they always shorten along that axis. So this muscle will move this way. This muscle will move this way and shorten. So the actions for the first muscle we're going to cover is called the masseter, and that's here. It attaches to your mandible. So as far as origin and insertion, you should be familiar with these, but you obviously don't have to memorize all of these because you could easily look it up if you needed to. So I'll give you the origin and insertion, and if there's something important that I think you should know about it, I'll let you know then. For the action, I'll focus on the major actions you need to know. So the action is the movement. So if we look at the masseter, we have it shortens along this direction. So it's gonna move the mandible, and it's gonna move the mandible upward, and so we call that elevation, which you learned from the articulations lecture. Another movement associated with the masseter is protraction of the mandible. So protraction, remember, means move forward. So since the fibers are running at an angle like this, not only do they pull the mandible up, they pull it a little bit forward. So you have to envision that when you're learning the movements of these muscles. All right, so masseter, we're going to have elevation, which is basically closing the mouth, and protraction, which is moving the mandible forward. So as the next muscle is the temporalis, which is here, and origins on the temporal bone. Insertion again is the mandible. So you're still going to get the elevation. So this muscle, this is what we're talking about. So if these fibers shorten in this direction, it's going to pull the mandible up. I know you can't see them attaching because it's behind all this. And then the other thing, since a lot of the fibers are running like this, it has a tendency to also pull the mandible back. Remember, we call that retraction. So the temporalis muscle causes elevation of the mandible and retraction of the mandible. So another picture, so temporalis, masseter. All right, this muscle, there's one on each side, so it's found on your neck. It's called the Sternocleidomastoid. So the origin is down here on the sternum and the clavicle. The insertion is the mastoid process on the skull. So notice that there's one here, and there's going to be another one on this side. It's just not shown. So the fibers are running up and down, and then secondly, they're also kind of running at an angle like this. So the easiest movement here is if both of these, the right and the left, contracted at the same time, because it's just going to cause straight neck flexion. So your chin's going to come down towards the chest. Where this gets interesting is if just one side, like if this right side contracted only, the person's head would turn to the left. It would make it rotate that way. Likewise, if you had one here on the left side, if it contracted by itself, the head would rotate to the right. So rotation of the head to the opposite side. So there's the sternocleidomastoid. This muscle also forms that nice triangle in your neck when you turn your head to the side. All right, muscles involved in breathing, or respiratory muscles, include the diaphragm. The diaphragm is a big dome-shaped muscle that sits here, right beneath the lungs, and its origin is huge and runs all around here. So obviously you don't have to memorize that. The insertion is unique though, because this is the only muscle we're going to talk about that that does not insert into a bone. So it kind of just inserts it to itself. So you have this connective tissue in the middle, and then the muscle is all of this around it. So this insertion part is called the central tendon. And when the diaphragm contracts, it just moves downward. So you could call it depression. I guess people just say it moves downward or it flattens out. All right, other respiratory muscles include the intercostal. So there's external and internal intercostals. And for the origin and insertion, not overly important. So the action is important here. So your external intercostals, they run in this direction. So they run more, if you want to envision like down into the front of the body. Whereas the internal intercostals are beneath, they're deep to the external, and they run perpendicular to that, back the other way, kind of like down into the back. So the movements are important because the external intercostals cause elevation of the ribs, like you're taking a deep breath and inhaling. And then the internal intercostals pull the rib down, so depression of the ribs. As far as abdominal muscles, the big abdominal muscle here in the front is called the Rectus Abdomenis. Its origin is pubic symphysis. And then insertion is all of this, all along the ribs, the xiphoid process of the sternum. So not overly important there, but this is it. You should be able to identify it. So anatomically, we have some things going on. You get these little connective tissue strips going across. Those are called tendinous intersections. This connective tissue that covers it, and in reality, this would be on both sides. This is called the rectus sheath. And then that line that runs right down the middle, kind of divides it in half, that's called the linea alba. All right, so as far as actions or movements, so flexion of the vertebral column, which is basically if you're doing a crunch, flying on your back and you sit up, you feel your abdominal muscles contracting, so that's the flexion. And then also just compresses the abdomen. So if you're trying to stabilize your back, you could just tighten these muscles and it would help stabilize the spine and cause compression of the abdomen. The other abdominal muscles that are important include the external obliques, which are like this, and then the internal obliques beneath them run in the opposite direction. So similar to the external intercostals, the external obliques run forward and down, whereas the internal obliques run down and back. And so they're perpendicular to each other. As far as the movements, so this is where it gets a little bit, if you're talking about both sides contracting at the same time, it's pretty easy. So if both sides contracted at the same time, then we would call that bilateral, and you just get flexion, just like you were doing a sit-up. But if one side contracts, this is where it gets interesting. So if you envision the left external obliques right here, if they contracted by themselves, the torso would rotate to the opposite side. So your left external obliques would cause you to rotate to the right. Likewise, if the right external obliques contracted by themselves, your torso would rotate to the left. Then the internal obliques, same thing, bilateral, you just do a sit-up, and that would be the flexion of the vertebral column. But if this time, if the left side contracted by itself, the torso would rotate to the left. If the right side contracted by itself, it would rotate to the right because the fibers are running in different directions. So you have to kind of use your imagination to feel like, see which direction they're shortening. All right, so another abdominal muscle which is deep to the obliques is called the Transversus Abdomenis. You can see why it's called the transversus, because it's running in the transverse plane. And all this muscle really does is cause compression of the torso right here. All right, and then we're going to finish off with a couple muscles in the back. So the Quadratus Lumborum, which is this muscle right here. So it runs from the iliac crest to the hip bone, up to the lumbar vertebra. So this is in the back of your body, so you have one here and you'd have one here. So if both sides contracted at the same time, the big thing you get is you get extension. Like if you're trying to straighten out your back, extending your vertebral column. And then if one side contracted by itself, let's say the right side contracted, you would kind of do lateral flexion to that side. And then lastly, Erector Spinae. These are three muscle groups that run up and down your spine. So here, you see like three different muscles right here. These are called the Erector Spinae muscle group. There's three subgroups, the iliocostalis, longissimus, and spinalis. And you can see as you go from medial to lateral, it's spinalis, longissimus, and iliocostalis. And each of those subgroups have other parts to them. You don't need to know that, but I'm putting this up here just kind of FYI. But really, what you need to know is if both sides contracted, your erector spinae on either side, both sides contracted, you get extension, just like you're extending your back and standing straight up. And then if one side contracted by itself, you might get some lateral flexion.